See the next system, the nasolacrimal system here, and see the maxillary sinus completely opacified. Okay. Now going behind, you see the roof of the anterethmoid coming into the picture as a cribiform plate. Can you see? The septum continuing as a crista galli above, and this is a well-developed cribiform plate. See the next picture. The two attachments to the cribiform at the junction of the horizontal and lateral lamella are projecting down are the first part of the middle turbinates attached to the cribiform plate at the junction of horizontal and lateral lamella. This is important to understand to deal with this upper part of the turbinate, not to forcefully manipulate it, otherwise may give a distant lead and a CSF lead. Okay? Fracture in the CSF lead over here. Okay? Now see the opacity completely occupying the frontal recess and the anterethmoid. This is the anterethmoid roof, that means this cavity is the anterethmoid. Once you see the cribiform, you refer to the anterethmoid cavity. Normally, see, this picture, this scan is a soft tissue window scan. You don't have a bone window, otherwise you would see the bone details much better. You don't see the cellularity in this opacity at all. But there are a number of cells, the most prominent being the bulla-ethmoid element in this level, in the anterethmoid. Okay? Now, going further behind, in the anterethmoid cavity, the next structure we should try to locate for our surgical reference is the anterethmoidal artery. Now, at this point, another positive finding I want to show you, inferior turbinate below, this opposite middle turbinate lamella is pneumatized. Can you see? The entire turbinate lamella is pneumatized. On this side is completely opacified. And see in the next picture, if you refer to the cavity of the orbit, zoom into the orbit, please.
zoom होता है
Orbit.
ना ये बड़ा होता है
Zoom in. यहाँ पे
नहीं वो फ्लिकर होगा उसे zoom एवढा था उसका उतना ही है रेंज zoom एवढा ही है.
Now see in the orbit, there is the globe here and all recti muscles all around. Can you see? And here this is the medial rectus above the superior rectus, medial rectus, superior orbit rectus, superior oblique. They are coming close to each other, and at this point the orbit is weakening medially. The anterethmoidal artery leaves the orbit between the superior oblique and the medial rectus muscle, where they come in close contact to each other, and leaves by making a canal by means of giving a beak to the orbit. Beaking of the orbit, you can see. This is where the anterethmoidal artery leaves, and it leaves, form a canal in the roof of the ethmoid as the orbitocranial canal, and enters the lateral lamella of the cribiform. Can you see it clearly? That's the lateral lamella of the cribiform plate, where this canal enters and this artery enters into the anterocranial fossa. Now the moment you see the anterethmoidal artery, the roof of the posterior anterethmoid ends. So anterethmoidal artery is in the posterior part of the roof of the anterethmoid. Okay? So once you are walking towards the frontal sinus, frontal recess, your artery is miles behind. You don't have to bother about artery all the time. Now this is a good landmark to refer in the CT scan, that you saw the artery here, and the next scan, can you see this? The cribiform disappeared. And the flat ethmoidal roof coming into the picture. See that? Posterior ethmoidal roof. What does it mean? That once you see the artery, the anterethmoid ends and the posterior ethmoid roof starts immediately after that, a few millimeters after that, skull base. Okay? So, that's a good surgical reference while you are looking for the anterethmoidal artery. If you don't see from anterior to posterior, just refer to the ground lamella upper attachment, and the anterethmoidal artery is immediately anterior to it. Okay? Yeah. Now the posterior cells all clear, normal. See this opacity, like polypoidal opacity, is continuing in the nasal cavity. Posterior cells are ultra clear, both sides clear. Now the sphenoid starts, and see sphenoid is clear. So by and large, this patient has an inflammatory disease in the left maxillary sinus, left anterethmoid and left frontal sinus. And to begin with, that's all thanks to Nandu for keeping the cases in such an order that you start with the basics and then move on to more advanced cases. I must appreciate Nandu's commitment for keeping this range of cases. We have 19 cases for 2 days, all different varieties from basic to the most advanced pituitary and angioplasty.